That is a very interesting study because we have thought about this study at least 4 years ago when I come back from American. And so I think at that time, we think that at that time, the BTK inhibitor ibrutinib is a popular usage drugs and is a new drugs for this disease, and its efficacy is very high. I think 19% of the patients can get a response from this BTK inhibitors. But we know the single agent ibrutinib usage, we can't stop. We have a continuous use this. We can't stop this drugs. And the deep remission, the VGPR, there's no CR patient, and the VGPR is also not so high. It's about 20%. So, but the continuous usage of these drugs there's many problems from the side effects and the economic problems, because in China it's not included in the patient have paid by themselves. So that's the problem. They can't use in the lifetime. So we want to design regions that can increase the deep remission and use the time-limited therapy to treat the patient. So we just use combine the design. So which drug we want to combine? We think that because Waldenström always has two clone, the lymphocyte clone and the plasmacyte clone, monoclone. So we know that BTK target the B cell clone, but leave the plasma clone alone. So we combine the drugs that can target the plasma cell clone. So we combine it with the proteomic inhibitors. Why we choose this I? Because this is also oral drugs. We think that the oral drugs may be a very population regions for this chronic disease, because you don't need to go to the hospital. You can take the drugs at home. So we then just use the three drugs together for the regions. We want to increase the deep remission, and then we can stop the drugs in time limited. So we then design the 2 years time limited. At this time, there are 25 patients have involved in this clinical trials, and 20 patients have used more than 6 months. We can go the response evaluation. So now we think we got the primary endpoint, and we think most of the patients can reach the deep remission. But for this combination, there's still no CR patient, complete remission patient. So that's we thought we can got some complete remission patient, but there's no. So we think although it was successful regions, but we think that we still need more strong regions to get more deeper remission. So that's that's for this clinical trial we want to say. We think that time limited regions can reach using the combining strategy, but which is the best? We need more clinical trials to study it.